I'm Anna Godwin. I'm the Executive Director here at Community Impact NC.
I'm Erin Day, and I'm the Director of the Division of Coalition Support.
We are a statewide nonprofit that focuses on adolescent substance misuse prevention through community, parent, and youth engagement. And in the 1 year that we've been working, we've been able to assist over 30 community coalitions. People call us and they don't necessarily even know where to begin or what to do. They just know they want to address the issues of substances in their community, but they don't know where to start or what that looks like.
We have a variety of requests from we want to become our own standalone nonprofit to we need help with strategic planning and data collection to we don't know what we need help with.
What we do is really help them to walk through what we consider or what is proven to be the evidence-based process around community involvement and coalition development, the strategic prevention framework. And so we break that down for them in very understandable bite-sized pieces so that they can do that work in their communities.
It's a new coalition here in Johnston County. The focus is substance use.
Johnston County is a baby coalition.
I think we've been meeting maybe for the past 4 to 5 months, something like that.
They found out about us through training we held here and said, we need you.
And it looks like we're going to be focusing on underage drinking and vaping, which I'm really excited about.
We're doing the But Why activity, where it focuses on determining what the problem is, such as underage drinking in Johnston County and why it's occurring, and breaking it down.
They're collecting data, they're figuring out what their makeup is going to be, who they need to have at the table.
I have a teenager and a middle schooler, so I can tell you that they tell me, even in middle school now the kids are using.
A lot of the vape stuff does not have to be FDA regulated.
So I guess that's kind of availability.
Yeah.
My name's Lynn Worth. I'm a pediatrician. We bring in the medical perspective and we understand the needs and the understanding of addiction.
Every time we meet a new partner, we learn about a new resource.
Peers. And again, that feeds back to the perception of safety.
They're seeing at the parks that it's okay.
Some of these items are homemade, so they've increased some of the heat settings. They've added some of their own chemicals and additives to them.
Y'all want to get together and talk about them? Sure, let's go talk about it.
And the beauty of what we do is that we tailor our support to what they need.
They're not going to suspend the whole team.
And so when we leave, they feel empowered, they feel ready, they feel like no matter what they do next, they have the foundation to be strong in that effort.
My name's Robbie Hall. I'm the Director of the Department of Social Services for Richmond County.
Richmond County, I would say, is an intermediate.
And we're kind of the first place someone calls to ask a question or seek help.
Their efforts were prompted by the opioid crisis, and they began working on opioid-related issues within their community. They began to think, oh, okay, what do we want to do now? Where do we want to go from here?
And so we formed a coalition bringing everybody together to not only collect data, but find ways to, find new resources for prevention, intervention, and services in our community. Because you're the experts in the community through this task force, so if someone asks you a question about this information, you just had that data report. Again, this is all free. You can share it with anyone. You can use it for grant writing. We've had several that have done that. So please share this information because we are that resource. They're having some pretty good success reproducing this in Pender County. But again, this was a model based in Tennessee that they have looked at with evidence-based etc. to show that it does have an impact.
My name is Mary Barbie. I'm a senior community volunteer. For Richmond County, it means a better deployment of resources. We work better together as a team.
The resources are coming because of the work that you're doing, but I only see that growing.
All of this, it works together as far as collaboratively, so
Right.
it's good stuff.
And again, we're doing all this so that any county could potentially copy what we're doing, right? You just have to have the willingness, right? You have to have partnership, and we all have different programs and money which we're blending together to solve a problem.
The biggest carrot for having a coalition is you have a conglomerate of individuals who are able to share ideas and work together in different environments and different areas in your county who can help drive change.
prevention does not always work for every single person. We're not going to completely eliminate substance misuse. However, we do know that prevention efforts are effective and they do reduce adolescent substance misuse. And down the road, as adults, they reduce adult misuse.